Hi, everyone, and welcome to our virtual health event with UC Health. My name is Hannah Strepfer, and I'm the event supervisor here with the Highlands Ranch Community Association. We're so excited that you took your time out of your evening to join us to discuss retirement and mental health. We are grateful for UC Health Highlands Ranch Hospital as a community partner and happy to host this wonderful event with their assistance. Before we get started, I'd like to go over a few housekeeping items. We are recording the webinar this evening and we'll be sending it to you via email by the end of the week. During this webinar, your microphones will be muted. To ask questions, please type them into the Q&A chat box. This can be located in your control panel, either on the top or bottom of your screen. Our presenters this evening are Alyssa Henry, a licensed professional counselor, and Gina Myers, a licensed clinical social worker. Now, without further ado, I'll pass the time off to Alyssa.
Hi, good evening, everyone. It's exciting to be here. We are looking forward to talking with all of you a little bit about, or at least to cover some important things to consider with regard to your mental health and well-being in retirement. I am working to advance the screen right now and it is not happening. One sec. There we go. Gina and I are both integrated behavioral health therapists at UC Health here in Littleton, or excuse me, in Highlands Ranch at the Littleton Family Med Clinic. And I want to jump in first by kind of going over some of the topics that we hope that we plan to cover today, but also some takeaways we hope you guys are able to benefit from. To start off with, I'm going to go over some data and statistics regarding mental health and well-being and its impact on those who are considering retirement or retirees, and some of the benefits of kind of awareness and knowledge around that mental health and mental wellness. Also going to cover some common myths about mental health and mental illness that kind of help to dispel fear and anxiety regarding how common mental health is. Also going to go over some positives, some pros and cons about the decision to go into retirement. And Gina is going to then also continue with those pros and cons of retirement, some of the things to get excited about, some of the things to be aware of. She will also cover the importance of that mental wellness and how to support yourself or perhaps someone else who's in retirement. Also continuing with ongoing information about how to stay connected with others and community resources to support mental wellness and mental health in retirement. Finally, we'll conclude with some questions, just as Hannah mentioned. So first statistic that I think is poignant. According to the CDC, 20% of people over the age of 55, so that's not just people in retirement or considering retirement, but 20% of people over the age of 55 are experiencing some concern regarding their mental health. I think it's really important to define what mental health means, because sometimes it can get confused with mental illness. So when we talk about mental health, what we're describing is our emotional, our psychological, and our social well-being. So we're not necessarily talking about illness necessarily, but all of those components that can go into your overarching mental well-being. These things impact how we think, how we feel, how we act, and mental health helps determine how we handle stress and transition and adjustments. So as I said, some statistics regarding mental health, specifically with regard to retirement. As it says here, and I don't want to read this all word for word, but there is a significant amount of research that shows that individuals who are in the process of retiring or experiencing retirement, 25% of them have symptoms of depression compared to 12% that are not retired. And it's valuable, I think, also to talk about or define what we mean by depression. So symptoms of depression can vary, but there's some pretty common ones, such as low mood, low motivation, pretty consistent fatigue, loss of interest in things that once used to be interesting or pleasurable, appetite changes, feelings of hopelessness, difficulty concentrating, some of these in separation, we all experience some of those experiences or those symptoms sometimes. But when they are experienced simultaneously and for a specific duration of time, we can, as mental health clinicians, we can diagnose depression. What the statistic is sharing is that actually symptoms of depression. So overarching there is a depressive diagnosis of depression, but it's really common for individuals to experience subsequent and maybe not all symptoms of major depressive disorder, but commonly some of those symptoms like low motivation, low mood, lack of pleasure or interest in things that were once interesting. Additionally, because we highlight depression is a leading cause of suicide. It's one of the biggest concerns, mental health concerns that we address, Gina and I, and other behavioral health clinicians and psychologists. And we also know that with adults over the age of 65, that is the largest population of individuals who succumb to or die by suicide. Higher rates than any other group that we work with, that being teens, different races, all across the board. Additionally, there are increased rates of anxiety with regard to retirees. Anxiety can look like constant or continual rumination. It can feel sometimes like increased heart rate. We also know that substance use is increased in retirement, especially as people find that they're exploring more and more free time. Fewer obligations and responsibilities certainly lends itself to substance exploration, but when we get into substance use, we as clinicians also begin to become concerned about substance abuse, dependence, tolerance, things like that. And so we like people to be aware of that as a concern as they transition into retirement. And finally, maybe this one being fairly obvious to some, as people transition into retirement, it changes their social structure and changes who they spend time with. If you're working a standard 9 to 5, you might have a bunch of coworkers, colleagues, people that you see every day, and then transitioning into retirement changes that social exposure and can lead to some social isolation, which then can contribute to other symptoms like anxiety, depression, and other mental health concerns. Some common myths about mental health. The first one being mental health problems are rare. As I said, there's a difference between mental health and mental illness, but actually mental health problems are not that rare. In fact, if a person has experienced grief, if you have experienced grief or loss, you have likely experienced some symptoms or mental health concerns related to that grief and loss. So it is much more common than most people are aware of, also much more common than perhaps our media talks about. It's certainly getting more awareness. We are learning and researching and promoting knowledge around mental health and mental illness. So it's getting better, but that myth that it's rare is definitely a myth. Mental health as the myth that it is a sign of weakness. We know as clinicians that mental health can impact anyone and everyone at any age, race, demographic, socioeconomic status. It is not a failure of their personal qualities or characteristics. It is not a weakness. It is something that is largely out of individuals' control, but can be addressed and sometimes prevented. And that speaks to the last one, mental health problems can't be treated. That is a myth. Gina and I are in this profession and treat mental health and mental health concerns every day. We see progress, we see change, we see people improving their quality of life and well-being every day. Mental health and mental illness can be treated. Another myth, people with mental health problems are violent or dangerous. This is an unfortunate myth that contributes to a lot of negative stigma toward people that are experiencing mental health problems or mental illness. In fact, the reality is individuals who are experiencing mental health problems are more likely to be the victims of violence than the perpetrators. I think that one's is kind of a striking fact, because I think media portrayal and a lot of some of those catchy news headlines about someone who's experiencing a mental health concern or a mental health crisis They certainly stay in our memory quite a bit more, but it's unfortunate to realize that actually that individual might have more likely been exploited or victimized. So something to keep in mind. Again, mental health problems only affect adults. That is a myth as well. As I said, it affects mental health concerns, affect kids starting at the age of 2 or 3, and or sooner, depending on trauma and things like that, all the way up until end of life. And then finally, seeking help for mental health is a sign of weakness. Thankfully, stigma and a lot of those myths are being dispelled. And Gina and I are seeing a nice uptick in people accessing mental health resources, accessing therapy before crisis occurs. Seeking help for mental health problems is absolutely not a sign of weakness, shows proactivity and good concern for your own well-being and care. One thing that I always like to add with regard to seeking help, make sure that you're looking for individuals who have licensed credentials, that have the appropriate education. And finally, if you're not sure how to look for that person or those people that you might want to consult with, talk to your doctor, talk to other professionals that you trust, and get some recommendations about who it is you might be able to connect with to address any mental health concerns you might have. Why this matters, why we're talking about mental health and retirement and all of these stats and facts. We see, and research is showing, that there's an increase in use of behavioral health and psychiatric care for individuals as they are getting older. We see that as a good thing because that means we're reducing stigma in different generations, and different generational changes are allowing for that opportunity to explore mental health and address mental health concerns. We also know, as I defined earlier, depression is particularly specific. It is a specific public health concern with regard to those suicide rates. And we know that with appropriate care and intervention, we can prevent depression, we can prevent suicide with preparation, with knowledge, with education. We can help address some of those big numbers and those challenges that people are facing. It's important to note, and like this slide says, that since the pandemic, during the pandemic, and since then, we've noticed acuity or severity of those symptoms going up, and a lot more people, because of that isolation, the lack of control or sense of control, caused a lot of people to experience significant distress during that period of time. And even as we are coming out of that pandemic, we're still experiencing the residual impact of what that experience was like for all of us. When we talk about depression, we know that there are a lot of factors that can contribute to depression, and specifically in retirement, something to be conscious of. There are psychosocial, biological, and structural risk factors that contribute to an individual's risk of experiencing depressive symptoms or depression. Thinking about that transition from career into more free time, financial concerns, and again, lack of social connectedness, that idea that your social structures have changed, your social supports might change or minimize or go away. Overall physical health is something that we always, Gina and I are always talking to the people we work with about how their physical health is, because we know mental health and physical health are utterly interrelated. You can't really address one without making sure you're keeping an eye on the other. And then structural risk factors such as access to care and unfortunately, the inability or the challenge in diagnosing symptoms of depression in older adults, because there's a lot of other possible contributing factors, could be some health concerns. So sometimes depression gets missed. And I love this last line: while depression is common among older adults, it's important for anyone considering retirement or in retirement to recognize it's not a normative part of aging. It's preventable, treatable, and there are ways to make sure that an individual feels like they can overcome symptoms of depression and avoid depressive diagnosis or depression diagnosis, just by being more vigilant and making sure that you're keeping an eye on your health and well-being.
Alyssa, did you want to talk a little bit about what integrated behavioral health means, and like what we actually do?
Yeah, thanks, Gina. That's a great idea. So yeah, I'm really proud of this. Actually, UCHealth has a pretty cool integrated behavioral health program within the primary care clinic here in Highlands Ranch. It's novel and unique because UC Health identified several years ago that access to behavioral health services and addressing behavioral health or mental health and well-being concerns, behavioral health is kind of interchangeable with mental health, well-being and concerns, that access to that was really limited, and we were seeing again an uptick in needs and acuity, people experiencing greater symptoms of mental health problems and challenges that, like I said, are intimately related to your physical health and well-being. So UC Health said, we're going to throw a bunch of money at this, we're going to grow this program, and we're going to make sure that patients at UC Health have access to behavioral health, mental health support, and resources in their clinic. So Gina and I work directly and collaboratively with the primary care clinician, or excuse me, primary care physicians here at this clinic. We make sure that we are constantly kind of keeping each other updated on the patients that we mutually support. And that ultimately leads to a reduction in severity of symptoms and increase in well-being. And we're seeing that with that collaborative integrated care. Did I cover everything, Gina?
I think you did. And I think one of the best parts of integrated care is that you're not having to just blindly search online or try to figure out where to see a therapist, right? So we have patients that have seen their PCP for 10, 20 years. Their whole family sees this doctor. So it's somebody that they really, really trust. And so you have this person taking care of kind of your whole self, so to speak. And if they're recommending somebody in the clinic, it feels a lot more comforting, I think, to trust that recommendation. And it's much more easy to access. And so we're not the only clinic within UC Health that has that. I think we're up to, I feel like we're everywhere, like all over the Front Range, Western Slope, Southern Colorado, at all of the UC Health primary care clinics. And so we just wanted to make sure you guys were aware of that too. And there's other hospital systems that also use integrated care, but we wanted to brag about the model a little bit too. So I think now we covered it.
Yeah, awesome. Thank you, Gina. Yeah, so jumping back in, one of the other adjustments that you know, an individual is considering retirement or in the midst of retirement, there's a lot of factors to think about in making that decision, or if you're in the midst of that decision, one of the things that can contribute to well-being or challenges is that adjustment to, if you're married or partnered, your relational dynamics with that person that you live with. If you worked full-time and your partner, your spouse worked full-time as well, at retirement, you might be colliding quite a bit more. And so there's some adjustment to that, some awareness, and maybe some additional communication around how are we, like, I love this quote, older couples have to, in a sense, learn how to enjoy having lunch together. It can be exciting. It can also be challenging because you're spending much more time together. So as this slide notes, talking about creating structure and routine, some predictability, but some spontaneity, and also just making sure you're balancing some of the, okay, if there's a lot of downtime or alone time, I'm also cognizant and making sure that I'm looking outward, looking to connect with others, looking to be social as well, because it's so critical for health and well-being. And so, like we said, the pros and cons, I don't know if I like that term, but the benefits, the positive impacts of retirement on mental health. If you're currently in retirement, some of these may sound really familiar. Reduce stress. A 9-to-5 comes with email obligation, possibly a boss, something else, or just the having to fulfill those regular and daily obligations and less free time. So reduce stress, more time for leisure activities, lots more opportunity and time to get into a hobby if possible, or to pursue something you've never pursued before. And then finally, improve sleep. We're not having to wake up at a particular time every day to reach or to meet some employer's expectation of on time. We get to improve our sleep, which we know, Gina and I know, is critical as well for health and well-being and mental health. Getting good quality, consistent sleep is absolutely necessary. And I'm going to turn this over to you, Gina, now, and I'm going to keep working on the slides. So you just cue me when you'd like me to go to the next slide, okay?
Okay, perfect. Thank you. I feel like I got the much more fun half of the presentation because now I get to talk about some of the really fun aspects of retirement. This book was recommended to me by a previous colleague I had that is going into retirement herself. It's called My Time, and I put the author and everything in here so you guys can find it if you want to. It's on Amazon and everything. But this book is a really, really fun approach to what retirement can look like and what this second part of your life can really be. And something that I really like is that she kind of phrases it as a second adolescence. So one of the quotes is, at this age, you can be who you are and you love and respect people more. You have so much more insight. You have all the wisdom. And then you get to have all of this time, right? So a big piece of this too is that even since this book was written, life expectancy has increased quite a bit. And this has really pushed all of that kind of post-retirement time further and further into the lifespan or life cycle. So people are finding that they have more time in retirement that they had previously. I think Alyssa and I see a pretty good amount of retired folks in our practices. And there's the anticipation and the anxiety and the excitement of retiring. But then once folks are there, it's like, I have potentially 30 more years of this, right? So it can be overwhelming. And this book does a really good job of reframing it a little bit and really talking about how to take advantage of this kind of second adolescence and reinventing yourself. Next slide. Thank you. So obviously with the fun stuff in retirement, like we touched on a little bit, these are the negative impacts and some of these are a little bit repetitive, but just to go over them again, I think one of the biggest struggles that I see is that loss of identity and loss of purpose, especially with people who have been in a career or even more rarely, I think, at the same place that they've worked for 30 years or for their entire career. It sort of becomes part of who you are, if not all of who you are at some point. And so once you have retirement and you don't have that anymore, it can feel really hard to figure out like who you are, what are you doing if you don't have this. There can be a real sense of grief around that as well. And I wanted to touch a little bit on even the differences between grief and depression. Alyssa sort of mentioned it earlier that, hey, if you've experienced grief and loss, you've experienced, some mental health symptoms. The thing to remember is that, grief is a trigger, so to speak, and lots of people experience depressive symptoms after a significant loss. So loss of appetite, poor sleep, not wanting to talk to people, be around people, lots of tearfulness, right? And even though as therapists, we don't like to use the word normal, those are considered more normal responses to a big loss. I think it's good to find a specific grief therapist if you're going through particularly sudden or, unexpected loss. But getting started with any therapist is a really, really good idea. Because it's a really normal part of, like I said, our lifespan. And along with all of that, right? So reduced social interaction, contributing to those feelings of loneliness and isolation, especially even folks now with the pandemic quieting down a little bit, there's still a lot of concern about health and in the community. So people are still kind of struggling to come out of that, I think, too. Financial concerns, that's a huge one for people. Folks are extending their time in the workforce or returning to work after retiring to make ends meet. I think everyone's probably aware that the cost of living in Colorado has continued to skyrocket, and it can be a really, really anxiety-provoking thing to try and plan your retirement. A lot of folks end up moving to more affordable places, which might mean that you're moving away from grandkids or moving away from adult kids in your support system. So that's something also to really, really be aware of as well. Next slide. So addressing these identity changes in retirement, I think probably the biggest thing that I find helpful with folks is start thinking about these things sooner than later. Don't wait until you're already 1 year post-retirement with all of this time on your hands, having to look at your spouse, right, all the time. And you're like, what are we going to do with all of our time together? Right? So start thinking about it before you even get into retirement. I worked with a patient who unfortunately couldn't be on this presentation because he had some pretty serious medical issues happen, but he retired from Lockheed Martin back in December. And we talked about his plan for retirement for almost a year before he actually submitted his retirement. And a lot of this was just preparing for what's going to come next, right? So in this time frame, he did things like plan different trips with his wife, and he started focusing more on his hobbies that he already had, like photography, being more involved in the community and engagement, things like that, while he was moving into it, so that when he's been fully retired, now he has those things. And it doesn't feel like such a big shift in transition. A big part of our identity as a whole is looking at our own values and interests, right? What's important to you? If you're already connected to a church or to another community organization, know that you're going to have a whole lot more time and energy probably to give to that. And remembering that that's something that can be fulfilling as well. Exploring new activities. This can mean volunteering, finding new hobbies, reading that stack of books that you haven't been able to get to. And again, thinking about and identifying these things before you're into retirement fully. Connecting with others. We are social creatures. I think, again, all of us learned that lesson in the pandemic, that we really do need the connection and we need our community. Seeking professional guidance, just to reiterate what Alyssa said, talk to a trusted professional. If that's your primary care doctor, if that's your endocrinologist, they'll be able to point you in the right direction. I think especially at UC Health, it's such a vast network of us, but realistically, behavioral health support is a chat away. So we get questions all the time from providers about how patients can access some support. And then the last one is embracing the changes that come. So similar to our first adolescence, which is not as fun, I think, as the second adolescence would be, this is a big transition. It's a big change. And it can help to shift your focus on the new opportunities that you're going to have rather than focusing on what you're going to lose. And again, I know that that can be really challenging if you have to leave behind your support system or grandkiddos. But that's something, again, in therapy that Alyssa and I regularly address with patients as well. Next slide. Okay, so what can you do, right? So we've kind of given you all of the facts and information. We've given you some information on how to access therapy and support. These are more of those concrete things of what you actually can do. The biggest thing is to talk to someone about it. Again, be it a church minister, a pastor, your PCP, family members who have been through it, your pickleball teammates, because I hear pickleball's all the rage, right? Walking partners, any of these folks, just reach out. So with any depressive symptoms, anxiety, especially if you're having any suicidal thoughts, things like that, the most important thing is to talk to someone about it. And Alyssa and I will say it's just important to talk to someone, right? Don't keep it to yourself. Stay connected. Try to be aware of how you're feeling. That link between our physical and our mental health is huge. And we see a lot of patients in primary care that have been diagnosed with a chronic illness or a terminal illness. And along with those things, there's a lot of mental health factors that go into that. And you don't have to deal with it alone. That's a big reminder as well. And ask about it, right? So taking care of others around you. If you notice that your pickleball teammate is more withdrawn than usual, or they seem more sad most of the time you see them, ask about it, right? It never hurts to reach out and even just mention it. You never know what someone's going through, and that also helps you stay connected as well. Next slide. Thank you. Okay, so Hannah also wanted us to touch on how to support someone else who's retiring. So I think most often this would be a spouse or a partner that you live with, and maybe they're retiring before you, right? So you're still working your full-time job while your partner gets to sleep until 10 a.m., right? And it can be really challenging because your whole rhythm is sort of changed at this point. And to reiterate again, it's a big time of transition, I think, for everybody, and allowing that space to adjust to this new lifestyle. So oftentimes we'll see that our sleep wake schedule will be different. Folks tend to stay up much later than they did when they were working, because like Alyssa said, you don't have that 9 to 5 grind that you have to do every day. An increase of free time. So you might notice your partner hanging out and watching more TV, right? And that's very different than before, which can feel hard to deal with at first. Acknowledging their feelings as well. So someone who's in retirement, especially newly retired, might be feeling a lot of different things like fear of the unknown, feeling a loss of purpose, some sadness, and on that same other side of the coin, they might also be feeling really excited about their accomplishments. And it's important to meet them where they're at and support however they're feeling. And like I said before, helping in retirement preparation. So thinking about connecting to the community, talking about household responsibilities and if that's going to look different. Most often when there's miscommunication between two people, it's really because there's this difference in expectations. So if you're expecting your retired spouse to finish your whole honey-do list in the next month, right? It would be a good idea to talk to them about that and not necessarily assume that because they have all this new extra time that that's what they're going to agree to do or that that's what they want to do. So it's just important to communicate those things, be it through writing or having a conversation, and acknowledging again where the other person is as well. Next slide. Okay. So again, these are some things that you can do to improve your mental health during retirement. So if you're finding that you are feeling isolated and disconnected, these are some of the things that we recommend often, not just for folks in retirement, but for anybody who's struggling with some mental health issues. Volunteering is a great one. And giving back to the community can also promote a sense of healing and definitely give that sense of purpose. Coming to therapy, obviously. I've been really excited since starting this practice over the last couple of years to have retirement age folks coming in for the first time to therapy. It's never too late to come to therapy, and it can really be valuable to unpack some of the things that you've maybe been carrying around for a really long time. Finding a new hobby, right? Picking up photography, looking at the community center to see if there's a photography class that you can take, finding a new exercise that you like to do. Travel is a really big one now that the pandemic has slowed down and things are opening back up again. Definitely making sure that you're taking care of your physical health. So obviously, as we age, our diet needs are going to change. And so what you put into your body is definitely going to impact how you feel. And so remembering to keep that, the mindfulness around the connection there. Meditation, again, I think there's an overwhelming number of apps and YouTube recordings for meditation that if you need it narrowed down, you can always ask somebody about that too. Next slide. And these are just some of the ideas. So I often will talk to patients about their travel plans. So even if you feel like this is something you're going to plan in 3 years down the road, the process of just planning it and having something to look forward to, whether it's a cruise or just a road trip somewhere, can be hugely impactful on your mental health and give you, kind of that light at the end of the tunnel if you're really struggling. Gardening is a big one, spending time outside, adopting a puppy or another animal can be a really, really great way to get into retirement and have companionship, and it also improves mental health as well. Biggest thing again is staying connected. We have a lot of different ways to stay connected. We have social media, you can text people. It doesn't just have to be in person, face to face. Just like now when you guys are jumping on a webinar. And it's great that you're willing to make those changes too. Volunteering at your grandkids' school, anything like that, even if it's once a week, can be hugely beneficial. And it's actually really fun. In therapy, we talk all the time about these ideas. So a therapist can do a lot more than just, I think, what people kind of think about when they look at coming to therapy, which is like, we're just going to talk about all your feelings, right? Yes, we will get to that. But also, we want to talk about practical ways to help you feel better. And so brainstorming with a therapist can be really, really helpful too.
I'm going to jump in too, because the value of staying connected. One of a common theme, I think, when I'm talking with people who are considering retirement, already in retirement, is also apart from the sense of isolation, the sense of possible disconnect or distancing from kids and grandkids. Sometimes it's family members, kids and grandkids, adult kids and grandkids that think, oh, they're going off to retire. We're going to let them enjoy their retirement. And there's not a ton of awareness around, oh, in all of that free time, my mom or dad, my loved one might want me to connect with them more often, to schedule some more opportunities to connect, to have dinner on a regular basis. Or like Gina mentioned, grandma and grandpa might want to help out with childcare or to babysit or come to an activity with at the school. As people are considering retirement, I find myself more and more often saying, are you having good conversations with your extended family and relatives about how you'd like to see retirement go, what kind of involvement you'd like in their life or theirs and yours? Again, going back to kind of that foundational aspect of it's all about communication. It's about thinking, planning, dreaming, and then making sure you're talking with your loved ones and your partners about how you want to stay connected and what your dreams and plans are.
Thank you. Yes, absolutely. Okay. I'm not going to read through all of this because there's a lot happening on this slide, but we found it really important to give you guys some resources in the local community. So these are very Highlands Ranch and Douglas County specific. Obviously, you know about the HRCA. In these, there's the senior club where there's a lot of different activities. One that I forgot to put on here is an app called Meetup, which is a way to find other people who are interested in the same thing as you. So there's a lot of those singles meetups. I know that there's, sorry, my dogs are barking like crazy. But I know that there's also some ones around hiking and mountain biking and dog parks even. So that's a great way to connect with others, is just around mutual interest. One that I really wanted to highlight is Ollie. So this is at the University of Denver. And this is adult learning, basically. They have gone back to meeting in person, but I've had several patients do this, and they've had nothing but good things to say about it.
Can I just, okay, so I'm just going to jump in one more time. So the University of Denver is my alma mater. And just as someone who was a student, both an undergrad and a graduate student there, I had individuals of every age, young, new grads or new undergrads, 20 somethings, all the way up to 80, 90. I can recall having some of those individuals auditing classes, which is like the Ollie Institute. The University of Denver is very flexible about like, hey, I'm interested in this class. I don't care to have credit for it, but I would really like to learn about this. And can I say, from my perspective as a younger person in those classes, it was always so enriching and so enjoyable to have the perspective of all different ages in those classes. I know that some people at older ages can be reluctant about, oh, I'm going to be sitting in a classroom trying to learn with a bunch of people who are super tech savvy, whatever. I personally, as a younger person in those classes, so loved it when people who were in retirement age came and joined us. I learned so much more. So want to encourage that one and put a plug in for that.
Yes, we're both DU alums. And the next slide. So these are just our sources if anybody is really, really curious about where we got our info. And then I think the next part was we were going to open it up for some questions. I did see some in the question and answer boxes. So I typed out some answers there. Someone had asked about long haul COVID support groups, and we do have one through UC Health. And so I will send Hannah the flyer for that, and she can share or distribute.
We're just going to answer those questions live too. So for the people that didn't ask them, they can get those answers too. So I'll just read the questions to you, and if you guys just want to answer, that would be great.
Sure.
So the first question was, does UC Health Highlands Ranch have any groups for COVID long haulers? Unfortunately, COVID made me expedite my retirement.
Yep, so we do have that. It's fairly new, and we also have a long haul COVID clinic, and it's to address the medical symptoms of long haul COVID. I just know for that one you have to get a referral from a physician, but for the other one, which is the support group, there you can just call and add your name to it. So I'll send Hannah that flyer to share. And then I think the other one that I answered before you got to it, Hannah, sorry, was about, what if you're somebody who's alone and you don't have others around you to maybe notice any behavior changes or notice if you have some depressive symptoms, which I think is a really good question. I know that all of our primary care providers through UC Health administer 2 different screenings when they see patients. And that's for depression and for anxiety. They're really short screenings, but that's what we use. And that's what the physicians often use to flag somebody for me and Alyssa to see. And so if you're curious, we always recommend talking to your doctor first. There's also always the crisis line. So the great news about that is that it's 3 numbers now, so it's 988. That's all you have to remember. And the Colorado Crisis Line has people called peer specialists. And peer specialists are folks who have been in recovery from mental health or substance use issue for a long time, and they actually just provide support. So if you just need to vent, if you are curious about whether or not you might be depressed, they're also a great sounding board and resource. So the hotline here doesn't just address, suicidal thoughts, but they do a number of different things to support folks that call. Anything you'd add, Alyssa?
Yeah, I was just going to say, I'll add with that crisis line. Some people can feel, Gina and I talk about mental health and wellness and really challenging topics all the time. So even in this presentation, we kind of talked lightly about really challenging, like I said, really emotion triggering topics like suicide. Individuals who are feeling a little bit of trepidation about seeking support, feeling vulnerable, feeling sensitive, feeling very cautious. I'm not sure what's going on. I'm worried. That crisis line support is also anonymous. So if there's an element of like, I'm not sure who to talk to, and I don't trust who I should talk to, all of those things. Of course, we want to say, trust your physician if you can, trust the people. But if you're feeling any kind of hesitation, there's no pressure with that crisis line to reveal any information except for what you want to share. And it's really important, again, like Gina said in one of her slides, to talk about it. So if you're not ready to talk about it with somebody talk about it with someone. And the feature with with that crisis line too is even text messaging is an aspect of that. If you're not ready to talk on the phone or to say the words out loud, text messaging is an option as well. So it's a really critical tool and very powerful in supporting our community.
Yeah, thank you for pointing that out. That's a really important point.
Great, thank you, guys. That was an awesome answer. So we do have some more time for a few more questions. If you do have a question that you haven't asked yet, please type that into the Q&A chat box in your control box. So the next question I have for you too is, how do I get started if I want to talk to someone?
Gina, you want to field that one?
Yeah. So a couple of different ways. I think that unfortunately, one of the most important considerations to make is insurance coverage. And so I usually tell folks, start with your insurance. There are a lot of countries that accept Medicare, but I know that it's complex because there's so many different carve outs and everything. So check with your insurance directory. Most websites for carriers do have a big mental health provider directory, but it's not always updated. There are a couple of bigger organizations in our area that Alyssa and I frequently refer folks to. Hannah, I don't know if it's helpful for me to just send it to you, or if you want me to just say that information right now, or what would be best.
If you could do both, I will send out an email later this week, so I could definitely include it in there.
Okay, perfect. So one of the ones that we refer to often is called Life Stance, and they do work both virtually and in person. And they have locations and providers all over the Denver metro area. I think they go off and on having a wait list, but they accept Medicare plans. Another one is the Mental Health Center located in like Arapahoe and Douglas County. So it's called All Health Network. And they work with Medicare and Medicaid patients as well. When you do an intake, which is that first appointment when a clinician meets with you, you just have to make sure that you let them know that you have Medicare, and you fill out paperwork beforehand. If you're comfortable using the internet and searching for things, most of these websites have their intake paperwork on there, so you can fill it out and be ready to go before your first appointment. As far as maybe what to expect to that first appointment, so like I mentioned, that first one is often called an intake or an initial assessment or evaluation. Usually they take around an hour, sometimes more. And the clinician is just going to go through lots and lots of questions with you. So about your mental health history, your substance use currently and in the past, whether or not you're on any medications for mental health. They're going to ask about your sleep, right? It's going to feel like a lot. It feels invasive if that's not something you're prepared for. But that's because they want to get this big assessment of what's happening to really point you in the right direction and make sure that you're paired with another clinician that can best meet your needs. It's common, and it's definitely okay to have a gender preference, to have a cultural preference of somebody of your same or different cultural background. There's plenty of LGBTQ therapists as well, if there's any of those considerations that need to be made. Same thing with couples therapy. So like we mentioned, there's a big shift in relationships. And so Denver Family Therapy or the Denver Relationship Center are great resources. You can even see DU interns, sometimes for a reduced rate or for free, who still do wonderful work. So there's a lot out there. And again, just to reiterate again, like if you're not sure, just ask. Ask Hannah, she can shoot us the message, ask your providers. There's lots and lots of support out there for it.
And I'll just jump in that, like Gina said, if you're not sure, ask. This integrated model is rapidly becoming the way that service and mental health service and support is happening. So whether your primary care physician is a part of UCHealth or some other system, primary care physicians also know how important mental health and well-being is. And so if they don't have a behavioral health integrated behavioral health model within their clinic, they are absolutely savvy about what resources and referrals they can help coach you to or direct you toward, to say, hey, this is where we commonly direct folks who are looking for outpatient counseling or additional emotional support. So, yeah.
Yep.
Great, thank you both. That was very helpful. Next question we have, if I have a mental health issue, how long will I need treatment for?
I can take that one. That's an excellent question. A difficult answer because it depends on a variety of different factors. So it's kind of a short version to say, like, I often see patients for 8 to 12 sessions, and that can make some pretty significant progress or change in that person's life. Doesn't mean that they're 100% better. Doesn't mean that all of their problems are gone. Doesn't mean that they don't still have to access coping strategies and they might still experience some symptoms of depression or anxiety. But I say that 8 to 12 sessions really tentatively, because sometimes I only see someone for 2 or 3 sessions. All they need is some information on sleep hygiene. We figure out during the assessment process that, wow, your sleep is really crummy. Let's see if we can't make some subtle changes here. Come back in a week or 2 and see if that's helping with your mood and other symptoms you might be experiencing. And then there's other cases where individuals have maybe a significant trauma history on top of current challenges with depression or life change or adjustment. And 12 sessions is not enough. I wouldn't say there's a cut and dry timeline. And oftentimes that's communication between you and your therapist about what makes sense. Have I made enough progress that now I want to take a break and step away and see how I can do on my own? Or I'm not comfortable yet. I'm still experiencing these symptoms. So it's oftentimes a case-by-case scenario and a really good and important conversation to have with your therapy provider around what makes sense as far as duration. Unfortunately, I'll add one other caveat. Insurance and the amounts that therapy might cost can also dictate length of time, but that's kind of another healthcare concern, but something to certainly keep in mind.
Yep. Great, thank you. And it looks like we've covered all of our questions. Oh, one more question just popped up. Does a patient session with you go with their UCH medical records?
Oh, that's an excellent question. It does. So part of the integrated model, and again, this is just speaking to UC Health, is that our behavioral health notes live in your medical record. And so that means that your primary care provider and any medical provider that accesses your chart will be able to see our documentation. And our documentation is just enough information to make sure that we're on track with what you're in therapy for. So it's really focused on, okay, what symptoms are we addressing? How are we intervening in that? What's getting better? What's getting worse? And so we try to keep it pretty concise. And so we're not putting all the narrative in there about like your whole child abuse history, for example. I think, I don't want to speak for all therapists, but I know Alyssa and I use a lot of discretion when we do that. The nice part about having it in your record is that you don't have to retell your story 1,000 times if you were to see a different therapist. Your PCP who's prescribing an antidepressant, for example, can look at our therapy note and say, oh, it looks like you're doing a lot better. I see here that your irritability is improved, but we still need to kind of work on your motivation, right? We get to spend a lot more time with you than your doctors do. And so we can really get into those specific symptoms to help inform your care. And like Alyssa said, it's a really collaborative process.
Although it's kind of unique that our progress notes and our records are kept in the medical record, everything is protected by HIPAA. So there is that legal confidentiality, and this other aspect of it that is I can assure no one is reading any information about a patient purely to read about it. It's only for the benefit and care and integrated support of that individual.
Yep.
Great, thank you both. And now it looks like we've answered all of our questions. So friendly reminder, this webinar has been recorded and we will be sending the recording out with the flyers and information Gina gives me to you by the end of the week. Thank you again to UC Health for giving us the opportunity to learn about retirement and mental health from Alyssa and Gina. And thank you to all of those who joined us tonight. Our next virtual health event will be on Wednesday, May 5th on how to achieve healthy skin. We hope you have a great rest of your night and thanks for joining.
Thank you.
Yeah, thank you very much.